Hello friends, welcome to AI Medical School. In this video we are going to study anesthesia. The introduction to anesthesia, but before the start, the video, subscribe to the channel, press the bell icon, and like the video. So let's start. Definition of anesthesia. Anesthesia literally means no sensation. Derived from the Greek verb for to perceive. Oliver Wendell Holmes suggested the name anesthesia. History of anesthesia, 18th century surgery. Now, from these pictures, you can see, before the advent of anesthesia, it was very difficult for the surgeons to carry out minor or major surgical procedures, and these are the traditional and conventional pictures. Original in the Royal College of Surgeons of England, London. Historical review. 1771 Joseph Priestley, the discovery of oxygen. 1772 Joseph Priestley, the discovery of nitrous oxide. Late 1700s pneumatic medicine. 1798 Sir Humphry Davy's first mention of inhalational properties of nitrous oxide, relief of pain caused by an erupting wisdom tooth, but clinicians overlooked his suggestion. 1846 Horace Wells observed significant leg injury without pain, next day received N2O for extraction of one of his teeth. Early 1800s, recreational use ether frolics. History of anesthesia. 1540. A flammable, volatile liquid synthesized by Cordus, sweet vitriol. 1740. Frobenius named it ether, from the Greek word for ignite or blaze. 1842 used as an anesthetic, publicized as an anesthetic in 1846 by Dr. William Morton. Chloroform was used as an anesthetic in 1853 by Dr. John Snow. One of the most significant events in the history of medicine. October 16, 1846, Ether Day, first demonstration of the use of ether in anesthesia at Mass General Hospital. Ether Dome. Dr. William T. G. Morton, first anesthesia specialist. Historical review. 1850s, chloroform or ether, multiple deaths. 1863, nitrous oxide reintroduced by Colton. 1887, the first anesthesia machine, nitrous oxide and oxygen. 1953 fluorinated anesthetics. 1954 halogenated drugs, halothane, more pleasant odor, higher potency, favorable pharmacokinetics, non-flammability and low toxicity. 1960, enflurane, isoflurane, desflurane, sevoflurane. Xenon, inert gas, under investigation. Operation under ether in 1852. The effect of the gaseous inhalation in neutralizing the sentient faculty was made perfectly distinct to my mind. Massachusetts General Hospital, Boston. Types of anesthesia, local anesthesia, loss of sensory perception over a small area of the body. Regional anesthesia, loss of sensation over a specific region of the body, such as the lower trunk. Monitored anesthesia care, MAC, conscious cetacean observation and management of complications. General anesthesia, loss of sensory perception of the entire body. General anesthesia, definition. Loss of response to and perception of all external stimuli. Components of general anesthesia: unconsciousness. Analgesia, most general anesthesias are poor analgesics. Amnesia. Anxiolysis. Areflexia. Attenuation of autonomic responses to painful stimuli. General anesthesia uses intravenous and inhaled agents to allow adequate surgical access to the operative site. In inhalational general anesthetics use gas, which is nitrous oxide, and volatile liquids, like halothane, isoflurane, desflurane, and sevoflurane. Now in parenteral general anesthetics use barbiturates like thiopental, benzodiazepines like midazolam, opioids like fentanyl, miscellaneous drugs like etomidate and propofol. Anesthetic techniques. Inhalation anesthesia. Total intravenous anesthesia. Inhalation plus intravenous, balanced anesthesia, which is most common. Phases of general anesthesia. Induction, initial entry to surgical anesthesia. Maintenance, continuous monitoring, and medication maintain a depth of anesthesia, ventilation, fluid balance, hemodynamic control, homeostasis. Emergence resumption of normal CNS function. Extubation, resumption of normal respiration. Inhalation anesthetics. Gas enters the blood plasma, but rapidly leaves it in preference for a lipid environment, such as cell membranes or the brain. The partial pressure of an anesthesia gas at the origin of the respiratory pathway is the driving force moving the anesthetic into the alveolar space and, thence, into the blood, which delivers the drug to the brain and other body compartments. The old theory of general anesthesia. Induction. Anesthetic molecules partitioned into lipid bilayers. A non-specific miracle occurs. Cell lipid bilayer physical properties, or some general anesthetics produce stereospecific effects. Mechanisms underlying the anesthetic effect are not properly known yet. Then unconsciousness. Remove anesthetic. And again the exact opposite of the non-specific miracle occurs and patient wakes up. Receptors possibly mediating CNS effects of inhaled anesthetics. Potentiation of inhibitory receptors GABA. Glycine. Potassium channels and inhibition of excitatory receptors NMDA, glutamate. AMPA, glutamate. Nicotinic acetylcholine. Sodium channels. Inhalation anesthetics. Applying a gas, rather than a solid or a liquid. A special set of terms, concentration, microgram or liter or micrometer is possible but difficult because of the volatility of the drug MAC, minimum alveolar concentration, as a percentage, to induce pain-insensate anesthesia. MAC, the minimum alveolar concentration, the end-tidal concentration of inhaled anesthetic needed to eliminate movement in 50% of patients stimulated by a standardized incision. The alveolar concentration is required to prevent movement in 50% of subjects in response to skin incision. Standard stimulus represents brain concentration. Consistent within and between species. Additive. MAC is expressed as the percentage of in a mixture required to achieve the effect. Numerically, MAC is small for potent anesthetics such as sevoflurane and large for less potent agents such as nitrous oxide. Now, intravenous anesthesia. Intravenous anesthetic agents. 1656, first attempt at intravenous anesthesia by Wren, opium into his dog. 1934, use in anesthesia with thiopental. Many ways to meet requirements, muscle relaxants, opioids, non-opioids. Appealing pleasant experience. Narcotic agonists, opioids, used for years for analgesic action. Civil War for wounded soldiers. Predominant effects are analgesia, depression of sensorium and respiration's mechanism of action is receptor-mediated. Local anesthetics. Mechanism of action is by reversibly blocking sodium channels to prevent depolarization. Anesthetic enters on the axoplasmic side and attaches to a receptor in middle of the channel. Thanks for watching. If you found this video helpful, kindly subscribe to the channel and like the video.